Take the screen down, please. Okay. Good morning, everyone, and welcome to another Three Nations Dementia Working Group webinar. Today's theme is around the decision to delay the review of social care until the proposed date of 2028. The UK's government's decision to delay the social care review until that date has significant implications for people living with dementia and their carers. This delay exacerbates existing challenges, leaving individuals and families without the necessary support in some cases, and resources delivered in a timely manner. Dementia care is urgently needed, especially as the number of people living with dementia continues to rise. Currently, there are over 850,000 people recognised as living with dementia. I think that number's soft because of the low diagnostic rate, and is likely to be at least 1 million in 2 or 3 years' time. 70% of people living with dementia live at home, relying heavily on informal and unpaid carers. Thus, the delay is will cause significant difficulties for people. A concerning statistic is that approximately 25% of people living with dementia live alone and are identified as self-carers. And that's an issue which is rarely talked about, but it's a growing figure as well as the population ages, and maybe people who care for people are unable to do so. This delay in reforms means that many people will continue to face inadequate service, isolation, and a lack of support. The financial and emotional burden on carers, many of whom are already experiencing stress and fatigue, will only increase. There is a need for immediate action, and investment in dementia care services are essential. These will ensure that these individuals receive the support they deserve without delay. We have a panel to help us with the webinar, and they'll introduce themselves shortly. Your participation is not just encouraged, it's vital. Your comments, responses, and questions make this webinar a dynamic and enriching experience. Please submit your questions using the text box at the bottom of the screen. If you raise your hand, we won't be able to see you, but we'll try and answer the questions as you go along. We will monitor the text boxes for any questions and answer them, as I said, as we go along. One thing I'd like to say before we start is these webinars are created and produced and presented by individuals living with dementia. While we cannot handle individual queries, we're here to support you. We will try to guide you via the text boxes on where you can get help, ensure you feel secure and confident in your journey with dementia. Well, that's enough of the boring stuff and the housekeeping. Let me hand you over to our first speaker, who's also a member of the Three Nations Dementia Working Group Steering Committee, Dr. Joy Watson of Manchester and other places. So hand over to Joy. Good morning, Joy.
Good morning, everyone. Thank you, Nigel, for that introduction. I'm just, yeah. Okay, so firstly, I shouldn't be on this webinar today, nor should any of us. What's going on in this care system that people like myself should be fighting for our rights and the care we deserve? As Nigel has just mentioned, we deserve better care. You will hear from others on this panel. None of us have the energy or time due to our ongoing symptoms to be engaged in such activities. It goes without saying that people affected by dementia are vulnerable. But the decision to not bring social care reform in until 2028 is obscene. Some of us have been waiting a jolly long time for changes to be made. One problem is many of us don't have 4 or 5 years, due in part to our dementia deteriorating by the week. I'm not happy with the delay. Papers have already been written and promises made. Had the powers that be been true to their word, we would all be in a better place. Giving us hope for the future, then dragging their feet about the timing of any reform is, in my mind, and many others living with dementia, a disgrace. It goes to show that MPs and others know very little about dementia and our need to see progress. There are several priorities when it comes to implementing good social care. The government needs to include everyone in their plans. We with lived experience want to be heard and our ideas taken seriously. Speaking on behalf of carers, there needs to be a discussion about unpaid carers and how much they are valued or not valued. Many of us rely on our carers to stay out of hospital, to be taken to appointments, looking after us when we're unwell. The list is endless, saving the country millions of pounds. Both carers and people living with this condition would like to see more provision for respite, affordable respite. Specific training for anyone working in the care sector, ideally to introduce dementia awareness in schools and youth organisations. This would go a long way to reducing the stigma. People are not used to talking about dementia, but most people know someone affected by it. Therefore, we need the government to take the lead, not just on dementia, but many other disabilities. Dementia can no longer stay under the carpet. We all need to speak and let our needs be known. It's quite obvious that people affected by dementia are going to suffer, both physically and emotionally, if this reform is delayed. Our carers are going to experience burnout and stress-related problems, and those of us living with dementia aren't going to be able to care for ourselves. Thus, our quality of life is going to be eroded. In my opinion, the current care system is not fit for purpose. Many are falling through the net, be it because of financial hardship, a lack of community provision, a lack of help and understanding in our towns and cities. I believe that people affected by dementia should have a say in any reform. After all, one can only glean so much from a textbook. Listening to real people with lived experience is crucial if we're going to get things right. I would like to see more middle-range care facilities, getting the unfairly called bed blockers out of hospital and providing them with rehabilitation to prepare them for going home. Home is where most of us want to be. Our communities are doing some fantastic work when it comes to dementia. However, folks get disheartened when they are strapped for cash and can't provide activities that benefit people living with dementia. Loneliness and isolation set in, and we go downhill very quickly. So much of good care comes from passionate individuals. The involvement of people living with dementia, their friends and family, are vital in shaping the future. How dare we even consider not engaging with them? Groups that offer peer support are needed all over the country. A safe place where people are encouraged to voice their opinions and hopes. a non-judgmental and caring space. We may have to wait until 2028 for the decision makers to get their act together. But until then, those of us affected by dementia will stand side by side and support each other. Thank you very much for listening.
Thank you, Joy. That's a real powerful start. You can tell the audience agree with you with a number of hearts and hands that are coming up on the screen. Can you see them? The reactions?
Oh, yeah.
Yeah, there you go.
Thank you, everyone.
There's one question I got on. You've long experience at the sharp end of dementia, Joy, and I'm just not that there's any non-sharp end of it, but I'm just wondering, do you think that the current social care platform that we have, or system that we have, adequately supports people with all kinds of disabilities, not just dementia?
No, I said in the piece just that there's so many of us falling through the net that aren't receiving the care that we need. And hopefully it won't get worse, but I've a horrible feeling it could do. Does that answer your question, Nigel?
Yeah, it does, and it kind of builds on the kinds of things that I think are happening out there as well, that people get lost because they're not a priority, and things have to reach a crisis situation before anything's done, and a lot of damage is done along the way. I know other speakers will pick up on this, but I think it's absolutely worth saying that good social care is a human right.
Yeah,
as well as everything else, not just something that, oh, if we can do it, we will. I think it's very important that people realise this and the implications of poor social care in the long term as well. There's a comment here from Chris Matthews. Chris Maddox, absolutely brilliant, Joy, what you've spoken about. You are the voice of many of us living with dementia. You put into words what many of us are not able to do. So thank you for fighting the fight for us. We need action now. Helen Saville, I agree, the government is absolutely relying on the goodwill of carers. I know one of the other speakers will pick that up. And thanks from Zoe and Joy and June for your comments. And thank you, Joy. I'll probably come back to you. Thank you so much. Kerry. Right, our next speaker is Kerry Higgins from Welsh Wales, a friend of mine. I would say a partner in crime as regards one or two things we get up to. Hello, Kerry. Good morning to you.
Morning. Thanks, Nigel, for the invite and Joy. Powerful words there. To start us off today. Just to kind of introduce why I'm sort of here presenting today. Though I live in Wales and I cared for family and friends that were living in dementia for over 31 years. As a young adult carer and an adult carer, I guess my passion has kind of led me to be involved in projects not just across Wales but across the UK, and what impacts one nation impacts another, even though we are devolved. So for me, I think just to kind of echo the sentiment, really, I think the delay in the review is one of the biggest mistakes of our time. And if you sort of couple that with the the concern around the sort of long-term NHS plan, we talking of an untold, unknown impact, and I guess that's because where there are failures and delays in the system, it's people that take the brunt of that. It's people that feel the sort of impact. And I think something I just want to kind of make clear, when I, as a family, we cared for my dad for 15 years without any kind of support at all. And there's this awful impression of when you then take the decision that you need support from social care, that actually it's all about crisis. accessing support or taking that decision, or jointly, you know, with my dad should be about prevention. So it should be about enabling us, should be about supporting my dad to remain as independent as possible. And I think it's really difficult when we are continuously reminded of our rights, of what you should be able to access, and whether we choose to accept that, and what that support can provide. But it's actually another difficult, I guess, feeling when on paper you are told you should be able to access this, and due to issues in the system, and failures and all sorts of other issues within that system, that actually just by accepting and saying, yes, can I please have help, that you're already agreeing to accept potentially help that's not of where it should be and what the standard should be. There are pockets of brilliant support out there and care, but ultimately it doesn't feel valued and it's under-resourced, and that can have an impact. When having support coming into the house, and quite frankly, a lot of professionals didn't seem to be able to understand this, that where there were issues in the system, actually it impacts the care you receive, because much about that support is sensory, is about, you know, building those relationships, and you're trying to build relationships with people that are trying to keep a system or a service going, and they're doing it out of passion because everything else is quite not appropriate level for them. And that absolutely translates into the care. You can feel that pressure, which is often sort of unfair. I'm going to turn into a bit of a stats brat for a second. The statistics tell us there are over 5 million unpaid carers across the UK. My personal opinion is, take that with a pinch of salt. You can add onto that. And I think that works out at 9% of the population over the age of 5. And that made me think, because on reading that for a second time, I thought, why the age of 5? And on doing some research and from the experiences of my work, alongside Nigel and others, not just in Wales, but across the UK, is that support is coming from people that are still playing with toys. And I think that's really hard, isn't it? We always think of and the statistics tell us that 60% of unpaid carers are people that are sort of older than 50 years. But actually, one of the most, for me, the most impactful part of sort of thinking about the delay in the review was that we are impacting children's lives too. And children need support, whether it's from social care provision, or actually whether it's because they are supporting somebody living in their family with dementia. And that happens. I see that all the time. I've got a really good friend of mine, and a friend of Nigel's as well, whose daughter was really young when she was diagnosed, and we seem to forget that sort of impact. And interestingly enough, 60% of all carers are women. But can I just take a second to use this opportunity, I guess, to shout out, if you're supporting men, and not to make this about, battle of the sexes, men are less likely to ask for support. And this is why a delay in the review is even more impacted, because, as a female, I'm quite willing to, to raise my concerns and ask for help. But we have pockets of people that feel that's sort of too difficult. So I guess just to sort of a bit more about my experience about that care. On average, it would take us about 9 months to find a suitable respite provision. And when you start caring at around the age of 20, nearly give my age away there, it's really hard when you're told the only provision is to go into a care home. Now, we know things have moved on across the different nations, but actually in the 30 years that I've been caring for family, and I've, done so with maybe at the start out of moral obligation to family, but actually it soon became a real passion of mine. So I think the foundations of the systems that we currently have, we know are not working. Unpaid carers are not the sticking plaster. We, at the end of the day, when we're looking at things like hospital sort of discharge, etc., or even just supporting the community, we have people that are going home not knowing that the support is there. We are receiving what I call begging letters across social media saying, families, can you please support, your loved one to come home? And that's a horrible thing, to read a post that's making you feel guilty because you need a little bit of extra support. So I guess just to kind of sort of summarize really is that so the delay in the review for me is about people. So I'm talking about people that are living with dementia, people that are caring for family. I consider us to be the strongest asset that the governments have. Unfortunately, we're not supported that well. My respite after 11 days off in 11 years was a sewing machine. I didn't have time to use it. It's still in the box. I was caring 24/7. But I think the other thing is about passionate staff that support people every day, that step into roles because they want to make a difference, and actually they feel like they're letting people down. And the other thing is about, by the time the review comes into place, technology will have moved on, training systems will have moved on, things will be much more expensive from resources. So actually we may find that we are battling at the moment around trying to achieve care for X amount of pound an hour. By the time that review happens, we may not be able to afford any of the things we have now. So yeah, thank you, Nigel, and for everybody, and for the opportunity to kind of present. And I'll be sticking around if there's any sort of questions. But just to say, a quick ask that if you are supporting people, and not everybody has a family or has an unpaid carer providing care, but we need to be doing more. We definitely need to be doing more, because when you're caring, as I did, and more people are providing longer care, when I say on social media, I've just cared for 24 hours. When I mean 24 hours, I mean 24 hours. And people often think it's quite gimmicky, but thank you, and looking forward to the other presenters.
Thank you, Kerry. You've got some reactions as well from the audience, and I think the messages that you gave have come home. I mean, Jessica Galloway suggests that people are supported and not engaged physically and emotionally. I feel not enough home staff and other professionals within the social care sector have enough dementia awareness, and this needs to be made a priority. One of my questions to you is going to be, as an ex-carer, it's in two parts really. First off, the financial impact of caring. People just don't take that into account. No disability should be a gateway to poverty, but unfortunately, sometimes if you're in a caring role, that's exactly what happens. People give up work, sometimes highly paid jobs, to care for a loved one, and they get what is it, 63 quid carers allowance or something a week, which is, it should at least be the national minimum wage, a carers allowance, to make it realistic. And secondly is the lack of opportunity to learn more about the disability of the person they're caring for. Do you think there is a lack of support in that area, Kerry, that people don't get the proper financial reward first, and secondly, you don't get the opportunity to learn a little bit more about the people they're caring for?
Absolutely. I think when I started caring for my aunt 31 years ago, I made all my mistakes. I knew nothing about the condition. It was never spoken about. It was never called dementia. It was, and actually, when you think about it, there's a poverty of opportunity. And I gave up a long career to care for my dad. I say I gave up. I stood in a row of family members. They all stepped back, and I was still stood there. And to a degree, I do all of that again because of my love and commitment, to him. But I wouldn't be forced into poverty again just to be able to provide the care that he should have been able to access elements of from elsewhere. So I think at the moment, absolutely, we have carers that are living in poverty. They can't access carers allowance because they're of a certain age, or because a family member receives pension credit or other, benefits that impact. And you're right. I think that the quote is £3.70 an hour. It works out to an equivalent to and ultimately, I'll finish on saying that it cost me nearly £1,500 a month to care for my parents. And I never got to access a penny of that because my goal was for them not to live in poverty. So I encouraged them to access all benefits they could. But that meant I couldn't receive anything for looking after them. So it's widely noted in different pieces of research and surveys across organisations that on average it is costing unpaid carers to care for people. And I mean that with no hidden agenda of making people feel bad, but ultimately I would have had to taken 4 buses, even though I lived 15 minutes away, to get to my mum's. So I had to have a car and pay for the fuel. It's as simple as that. So it's poverty of opportunity. Absolutely. Thank you.
Thank you, Kerry. And I know you've been you are an amazing advocate for carers. And that comes clear. And it's sometimes something, there are little issues that escape us that we never think of. And our next speaker is Stan. Good morning, Stan.
Good morning, everybody.
And Stan is part of a unique 25% of people who are identified as self-carers. In other words, they live alone, and 25% of people with dementia do that. Stan has a unique way of describing his situation, and I'm going to hand over to Stan. Good morning to you.
Good morning. Right, everybody, I'm Stan, as Nigel has said. I'm 81. I self-care, and I have done since I was diagnosed with dementia 2014. I've lived on my own for 20-odd years. One of the things which is paramount for me is my independence. I found it very difficult the last few months to come to terms where I'm having to deal with social services. Yeah, I found that any delay that's going to occur in the review is going to compound the issue far worse than before. I've had a heck of a job getting social workers. I've had 2 social workers in the last 2 months. First one come along, did the assessment, took copious notes and everything else. And at the end of it, she said, "Well, you don't look like you've got dementia." Hang on. Look like what? Do I have a stencil on my forehead, or should I get a bell? I'm unclean. This is somebody who is a professional, a social worker. She gave an assessment which wasn't at all accurate about me or how I conduct myself. The second one came along. She did another assessment, took no notice of, didn't have the notes from the last person. And her preoccupation was, my flat is snowing with insects. What she was referring to, I've got a Lethbridge Gecko, and it's only about 4 inches, but it has live food. I have 8 boxes, 2 active and the other 6 are prepared, ready for the next delivery of stuff. So how, and they're all confined in one area, but that was her assessment of my standard of living. Reason part of my delay, I'm just getting used to this business of social services. Somebody came along to help me with my medication, because besides having dementia, I'm severely vision impaired. I've got age-related macular degeneration. I've also got bladder cancer, but that's easy enough. That my consultant deals with that. These people, if they're trained to be a social worker, I expect somebody that comes to me knows something about dementia. Can advise me. I'm very fortunate here in Merseyside that we have the only hospital, as far as we know, the only hospital which is dedicated to dementia, and that is Lee Moss Hospital. It used to be Mossley Hill. We have instant access to an OT, a clinical lead OT, or a psychologist. I have a weekly discussion with a care navigator. I think it's basically time for me to do a Victor Meldrew and sound off about what problems I've got. But that facility is there. I'm finding now, I'm on the borderline between Liverpool and Knowsley, Merseyside and Knowsley. And this lot is totally alien to me. I've managed for 80 odd years without social workers and so on. But when I get somebody coming along to advise me or to do an assessment, I expect them to be conversant with things I say. I've had just a visit, this is what I was a little bit late in starting. I've just had a visit from the fire prevention officer. Again, it's assessed the different problems I've got. But certain sections are conversant with what's required. My main argument is with this delay in the social charter, getting it sorted, it doesn't just want a review, it wants a complete overhaul from root to branches. It's so difficult to grasp in this day and age that we're paying good money. Oh, on the question of respite, I don't get respite as a self-carer. The net respite I get is sitting down in my chair and having a nap if I feel it. But it's wrong. I had carers provided by the social workers who are coming in. The first visit they came, girl turned up to do the provision, and at the same time the company that she came from came to work the contract out with me. That's how far behind the door they were. And I finished up, I was paying just under £16 for a 3-minute visit, or 3 to 4 minute visit to do my medication. They were supposed to help declutter my flat, and I don't mind admitting it, my place is a mess. That's what the fire officer was here for. But £15 for 4 minutes, and all they were doing was counting out the tablets. Because my sight's got to the point, yeah, I can feel the tablets, but I can't necessarily count the ones I've got. They count the 8 out that I'm supposed to be taking in the morning. Okay, bye, Mr. Limit, gone. 3 minutes. It's just preposterous. This is what's wrong with the system, I think. Money is wasted. It's all right doing a review, providing it comes up with what it's as Joy said, fit for purpose. And certainly from my point of view, it's not. I can only go on an individual basis. Yeah, I deal with fellow people that have got dementia. I think it's one thing that Nigel likes with me. I don't live with dementia. My dementia lives with me. In other words, it's got to fit around how my life is and the way I do things. Through the Three Nations, I've got another outlet that I can do a broad spectrum of chat right across the country. Yeah, we have a laugh. We deal with a lot of issues. But this is just part and parcel of it. I just hope that the powers that be that are doing this review do take on board the opinions that we are coming up with as regards. It's had been put to me. I'm classed as a person of experience. Besides one of the roles, I get involved. I'm a public advisor to a professor at Liverpool University, also another professor at Liverpool University on dementia. But it seems to stop. You know, again, I use the phrase going back 20 odd years, 30 odd years. I wouldn't be on here today talking to you. I'd be locked up in a mental institution. I mean, I've got capacity, but it counts for nothing if the services you're getting don't come up to scratch. You shouldn't have to sit and tell somebody just exactly what it feels like and what happens when you've got dementia, because that person is an expert. They've got a PhD or whatever to get that position, but they are not conversant with the topic. And that to me doesn't wash. As you can gather, I do get a bit Tom Eldrewish. A lot of this, by the way, well, all of it is off the top of my head. It's because I'm speaking from experience. Yeah, the more we can push, the more we can highlight, the more we can get involved, the better. Again, yeah, this is part and parcel of doing the webinar. It is done by those of us with dementia or the carers. We're living with it, sorry. It lives with us. I think that's all I can think of at the moment.
Oh, Stan, I mean, you sparked a lot of response in the chat box here. What would you do? We've got a question from Rushbal. What would you do, Stan, feel it is needed, and the type of questions you feel would have helped? I'm assuming that he's talking about your home visits from the social workers.
Yeah. Okay. Sorry.
I was going to say my feeling is the preparedness of some of the social care advisors and some of the people who deliver social care services is usually done under crisis, and you're one of 8 visits they're going to make that day. So consequently, they probably don't have the time to get the fuller picture.
No, that's fair enough. I'll go along with that. I can draw a comparison between an OT from Knowsley Services or the OT from Lee Moss Hospital. Lee Moss Hospital, the people there are not just clinicians, they're our friends. And I had the lead OT, came out and did an assessment of my place and everything else, but she's there as a friend. But most of the information I get is from the likes of the Three Nations. It's peer support because the professionals don't know anything about it. I can understand a GP not having a full grasp of the situation, but by derivation, they are general practitioners. But when you get people who specialise in social care or OT or whatever, they need to be available and conversant with what they're doing. I hope that answers that question.
Yes, it does, Stan, and I must say that you have eloquently and forcefully and quite humanly talked about your aspect as somebody living on their own, whose voice is never asked for and whose voice sometimes doesn't get listened to. I know people ignore you at their own peril, Stan, because I've known you for quite some time now. And I wouldn't like to be the next social worker that visits you, because obviously you've now got a bee in your bonnet, and I think that's marvelous. The one thing the audience is saying is that co-produced services are the best, and that's been sparked by your comments, and I absolutely agree. Co-production is the way forward for all services.
On regards to social workers I've now got very little confidence in the social worker system.
Yeah.
If somebody spends an hour with me discussing what I do and how my life is, this, that, and the other, and then turns to me and says, "You don't look as though you've got dementia."
Yeah.
What have I got to become the Alzheimer's Society thing of a little old man with a shawl around his, eating his bread and milk?
Yeah.
It's more to that. I've not lived 81 years without having some hiccups, but I've certainly lived 81 years and had a good life. I've got experience of life, and that's where people don't draw on those experiences.
Yeah. I think you've struck a chord with most of the audience here who are on your side, saying that there's nothing wrong with being victim elderly if things are not right. And I think the contribution you made today in particular, but during the Saturday Sunday socials and everything that we do together, is really gives another element to the word dementia care, because not everybody lives in a fully supported network, and that's obvious.
I'm at the stage now where I'm in the process. I'm with a group called Sight and Mind here in Liverpool, and they've been absolutely brilliant. But what they're doing now, they're trying to get the Halifax to buy my property off me with a view to me going into sheltered accommodation. That is going to be the hardest thing I've ever faced. As I said, yeah, I can live with my cancer. That's my responsibility of my consultant cancer specialist. My dementia, I can live with that because I've got very good peer support. The thing I can't, and I'm finding it very difficult to live with, is the loss of my sight. I no longer drive a car. I drive a white cane with a ball on the end of it. That brings multitude of problems. But there is comorbid. People are not just, again, I've come across this with doing the public advisor stage. They talk in terms of case notes. Whoa, just a minute. We're talking about a person. We're talking about somebody that's lived for a fair number of years, lot longer than the person that they're giving the question to. But this guy that's just come, the fire officer, right? I'm concerned about the electrical safety. Just a moment. 48 years I worked as a maintenance electrician for the local newspaper. I know I was also the first health and safety rep in 1982 or 1984 on Merseyside. So I know about trips and falls. But he's assuming that you're not taking into account. Listen to what we're saying as individuals.
Yeah, and that's the message. Thank you,
Yeah.
Stan. That's a very powerful contribution. And we're going to go to our next speaker, who lives in a different situation from Stan. It's Marilyn, who lives in sheltered accommodation. Good morning, Marilyn. How are you?
Good morning. Oh, quite good. Do tell me to shut up when the time's right, because I can go on and on and on. It could be 1 o'clock by the time I finish. I live in Worcester now. I used to live in Devon. I had to move because my daughter lives in Worcester and she has 4 boys. And she said, look, before you go completely gaga, come and live closer to me. And then if you have a crisis, I can help manage it. So I did. So I moved up here 4 years ago in the pandemic. So you got to know nobody. I found Worcester quite a good place to navigate. I had to walk into Worcester to go to the bank, which was a mile away. I had no idea where the bank was. So I asked someone, and believe it or not, they actually took me there. I thought, how kind. This is absolutely brilliant. I've landed on my feet. We had a jolly good conversation. I talked to her. Her daughter was a teacher. I had been a teacher. I'd been diagnosed in 2016. And she said, but you don't sound as if you've got dementia. I said, well, I can assure you I've got the certificate to prove it. So you've got all these preconceptions of what living with dementia is like. And I have battled with this ever since I joined the work that the Alzheimer's Society do. And I spend most of my time talking about dementia, whether people want to listen or not. I talk at the bus stop. I talk in the supermarket queue. You've got to converse with people to get your points across. Now, I was admitted to hospital last year with pneumonia, and my daughter came with me to A&E. Oh boy, that was an experience. 48 hours sitting on a chair. When the nurse called me into a cubicle, my daughter wanted to come with me. Oh, no, you can't do that. There's not enough room. Now, my daughter works in a care home. She said quite forcefully, my mother has got dementia. That's all right. I've got level 5 in dementia. Really? So that was that. There was no mention of not the Herbert protocol. It was the John thing, wasn't it? That you can have someone with you when you have dementia. None of that had been adhered to. And while I was there in hospital for a fortnight, passed from pillar to post, from ward to ward, where there was a bed, because there weren't beds. People were in corridors. And I was very fortunate that I wasn't put in a corridor. It became obvious to me that people with dementia were a thorn in people's side in the caring profession. They really did not know what to do. We had a lady who was rampaging around one ward I was in, opening all the curtains, shrieking, "Get out of my house, get out of my house." I thought, bring on assisted dying. I don't want to end up like this. And it went on. Everybody was they were so rushed, they couldn't cope. They had to get someone to sit with this woman 24/7 to keep her calm and in bed. It should have been done from the first place, not as an emergency remedy. My doctor there couldn't believe I had dementia. You haven't got a diagnosis of dementia. You certainly don't look as if you've got dementia. What does dementia look like? Do we all have to go around ranting and raving and stopping the traffic and, doing odd things? Well, my grandmother did. And she had what they called senility. They called that those days. She had senility. My mother was diagnosed with Alzheimer's. And as I grew older, I began to feel as if I'd morphed into my mother. And I thought, I wonder if there's a familial link. Nobody has actually explored the genetics of it with me. But when I eventually managed to persuade a GP while I was in Devon to refer me to a psychiatrist and the memory clinic, I was given all the tests. You have an MRI and bloods taken. This is in the 2015 period. And eventually they diagnosed me with cognitive impairment and Alzheimer's disease. So they prescribed the drug memantine. And I dutifully went away and took the drug. And being an ex-teacher, I wanted to find out as much as I could about dementia. And I read every book that was in the library about it and thought, I've only got 7 or 8 years. Flipping heck. So you'd better use them well. Well, I actually had someone from the Alzheimer's Society in the days when they did home visits, came out and talked to me and told me about Dementia Voice. So I promptly joined in. And I've had more support from the people, my peers, than I've ever had from anybody else. And I have tried advocating for people all my life. I used to work when I gave up teaching because I had what they then called ME, but I think was young onset dementia. If you look at the symptomology, it was very, very similar. I got retired at 43 from teaching. I taught for 22 years. I was head of music. in a comprehensive school. And they thought, oh, she's burnt out, or, you know, couldn't do anything, couldn't concentrate. Then I cut to the fact that when I was in my late 40s, my mother could no longer look after herself. She had Parkinson's, that was her diagnosis. And she moved to Devon so that I could look after her. And with Parkinson's came all sorts of other things, and one of the things was dementia. And I was really shocked by the lack of support you got from social services and from the incontinence team. Did you know that if you're incontinent, you're only allowed 3 pads a day? 3 pads a day? And this was in the days where you know, buying incontinence pads was really quite an expensive business to keep her in incontinence pads. They used to be delivered every few weeks in a huge box. But anyway, 3 pads a day. So when she went eventually into a care home, it was very, very difficult to ensure that she was comfortable with her 3 pads a day. And the staff there were pinching her pads to give to other people because they were so short of pads. Where's the dignity in that? When my mother developed jaundice, the care home hadn't noticed. It was only when I was visiting her, I said, she's got jaundice, she's yellow. Oh. So eventually a doctor came and carted her off to hospital. And she ended up with pancreatic cancer. And it was that killed her. So, you know, much of these things are left, swept under the carpet. Joy, you want to speak?
Yeah, I was just wanting to ask your feelings about the delay or the possible delay in social care. Where do you stand, really?
I think I have mixed feelings about social care. I have no wish to go into a care home. My daughter is a manager in 2 care homes, and they're superb care homes. But I don't think they'll be around by the time I'm ready for a care home, because it is so expensive to keep these care homes running. And I think I will have run out of money. I don't think I could afford what you would call an empathetic care home. I think I don't want to sit in the corner, wetting myself, talking to myself for 5 years or so. I'd rather be doing what I'm doing now and living a good life. And I think we all should be encouraged to do as much as we can. And I have found the secret to that is to get out and about. I'm very rarely at home. If I'm at home, I'm doing a Zoom, or I'm writing something for a university thing I'm doing, or, you know, or I'm exercising. But I really passionately believe that we all need to be given more tools in order to keep ourselves as well as we possibly can. And that includes diet and exercise. Now, I have been in a class this morning. I live in, as Nigel mentioned, in sheltered accommodation, which is independent living with a bit of an extra. It's laughingly called a retirement village. There's not much village about it, but we get 1 meal a week, which we pay for. It used to be 6 meals a week, but you know, the cost of everything and etc. etc. And I rent my place. I pay 800 something a month for the privilege of living here. But I don't pay council tax. Oh, that's one benefit of having dementia. And if you live on your own, You don't pay council tax. Oh, whoopee. So I've saved 1,000 or so. But where was I? I deviate. I go off the point, off the boil. And time is ticking on, as I'm aware. So I really think you've got to get out, you've got to move. I'm being taught how to walk at the moment. Now that sounds ridiculous, doesn't it? You put one foot in front of the other. But do you realise how difficult balance is when you've got dementia? And walking is quite something you have to think about. And so we laugh. You know, I never knew a Tai Chi class would involve so much laughter. We have 5 or 6 of us in our place who are paying for the privilege of having this chap who is in his 70s himself teaching us how to balance and how to walk to avoid falls, because we all know that if you've got dementia you are prone to falling.
Yeah.
Um,
Can I just say we run out of time, so only for a matter of time I need to close. Joe, you got one more question?
Yeah, I think we're all of the same view about the review. So I want to ask people, maybe you, Nigel, where do we go from here?
We keep on putting pressure. We keep on working towards good social care. We keep on insisting. They're now talking about, you know, the UK government is talking about the defence budget. There is money around, and the answer to it is a political solution, and the only way you'll get a political solution is by putting pressure on those who govern.
I just hope that the powers that be realise that a lot of us haven't got, I said earlier, a lot of us haven't got those years. You know,
Yeah.
we're quite exhausted at fighting for our rights.
There's been a social care review ongoing discussion for almost 21 years. And each successive government of both colours. Dementia care is not a Rosette issue, and it shouldn't be. It should be a national issue. It's coming to the crisis point now of care of the elderly and social care in general. And the sooner the review takes place, the better. But it can't work unless they engage with people who are in receipt of it.
Yeah.
You know, the 10-year NHS plan has proven that, because they didn't ask the right kind of people. Well, first off, can I thank you all, panelists, for amazing contributions, but incredible. I mean, I only go by the reactions that I get from the audience, and it's been so unbelievable. So thank you for your contributions. If you hang on a minute, so we have a debrief, and if I can ask all the participants to leave the room, so we have a debrief for about 10-15 minutes. And thank you so much. And thank you so much for all your contributions, and particularly the audience as well, for today. It's been absolutely amazing. And by the way, this will be on YouTube fairly soon, so you'll be able to rewatch it on YouTube. Thank you so much, everyone. Bye-bye, have a good day, and stay safe.